All right, so let's talk about what we can do, what we can offer, and to give perspective. I think we need to understand from the starting point that this is a disease and that these genetics are strong, and people are going to respond differently to some extent. Nobody's going to be exactly the same. However, there are some treatments that are more variable in how people do, and there's some treatments that are most people have a very similar response to. So, first of all, talking diet and exercise, there really are people out there who go out and lose their weight and keep it off for a decade, sometimes for 20 years. Most people, and this gets back to brain wiring and gut wiring and how our body tells us we're hungry and how our body monitors our perceived energy storage. And this is the problem with the way we think about diets. We can have control to the point of starving ourselves or putting ourselves in boot camp, usually for about 3 months to a year, and usually for about 20 to 40 pounds. Sometimes people can go over that. In fact, I see people every week who did lose 70 pounds once in their life, or even 90 pounds. But a lot of folks, when they hit about the 30-pound mark, the body starts to fight back. And I call this the same. This is your body similarly fights back if you hold your breath. The first 30 seconds is not much of a problem. The next 30 seconds, you are really having to focus and concentrate, and you cannot be distracted. The next 30 seconds, most of us breathe. There are people who can train and hold their breath for many minutes if they're deep divers, but fundamentally, their body is sending them stronger and stronger messages. Now, when your body sends the message and how strong the message is, somewhat is individual, but every human being is going to have starvation rescue messages. And even with the messages to eat, if there's no food available, your body will also start to lower your metabolic rate so that you can survive the perceived stress of or famine. So people are very different that way as well. And that's where you see people, especially middle-aged, who've had yo-yo dieting, and they go on a diet and they almost look like they have Parkinson's disease. Their energy just shuts down. They feel depressed, and they're trying to move and they want to move, but they really can't. And that, I think, the people who don't have that response are lucky, but they also don't understand what the people who do have that metabolic shutdown feel like as they literally, their body's almost going into hibernation, if you will. All right, so varying strategies are trying to help control those signals. Okay, medications really can be very powerful for some people. Exercise alone can suppress appetite in some people. Not everybody. There's studies that show that some types of exercise and a lot of what we do actually makes us hungrier, and we feel like we've been good boys and girls and we go eat more. So it's still complicated, but go and do your exercise. Don't overdo it. Listen to your body. But you want to be moving. There's no doubt about that. That is good medicine for everybody, with a few heart patient exceptions. If your doctor tells you not to, then listen to them. These interventions are changing the signals. They are designed to not make you feel hungry when you get to that point where the body is fighting back and it says, oh, you've lost X number of pounds. We are done. You are going to start eating whatever comes available. You're going to eat in the middle of the night. You're going to feel out of control. And in fact, you kind of are out of control, but it's not a willpower failure. It feels that way. But when you gasp for air after holding your breath for a minute or two, it's not that you didn't want it bad enough. It's that your body overcame your control. We like to think we're in total control, but we're not. We're in somewhat control, or influence is what I like to say. But we have a lot of control, but we don't have final control. So all of these things that I'm going to show you today, try to tweak that, and they are going to work for some people, and a few of them are going to have almost all of them are going to have a few people that they don't work for, but they're pretty darn effective, most of them. So first, medications I'm not going to go into completely because that is not my area of practice, but there's a lot out there, and I do think that people should consider medications for appetite suppression and to help them lose weight in a healthy, controlled way and in a supervised way. I think those really can be effective. There are various risks, and you do need to do it under physician guidance. and in a program. And you also need to understand that everything we're talking about doesn't work automatically. You really have to participate. It doesn't mean you have to be in boot camp. In fact, that's probably not good, healthy, long-term way to incorporate changes into your life. But all these things are going to have some changes, but not as much as people are afraid of. Again, you do not have to become perfect. So medications, that's about all I'm going to say about them. I do think one other quick thing to say about medications is they can actually help supplement surgery too. A lot of patients who have had surgery think, well, there's no reason for me to have medications, and they can really help sometimes when people, again, like I said, surgery doesn't hit every signal pathway in the body for everyone either. And some people who are having a little struggles with surgery, medications can help that. Definitely researchers have shown us that. So let me pop over a couple. I'm going to do a lot of show and tell here. I think I'll go to the next segment for that. We're going to talk just very quickly about cost, because I don't want to put it in the segment I'm doing show and tell. A lot of people misunderstand their coverage. They think they have perfect coverage and they don't have perfect coverage. A lot of people think they have no coverage when in fact they can appeal, they can go back and they can get coverage changed. People who are on federal plans, Medicare, federal employees, most Fortune 500 companies have a benefit. Most hospital employees have benefits. There are a few in rural Utah where the hospital doesn't have the benefit. The problem is small businesses, but that is changing. We are getting more and more small businesses able to purchase coverage. Now, we have a fair number of our patients actually self-pay, and the amount of money is usually less than people think it's going to be. It tends to be $10,000 to $15,000 for surgery, and a few of our other interventions are a little bit less, in the $7,000 or $8,000 range. But that's usually, a lot of people can afford to save up for that, or even borrow that from a credit union or their bank or family. There is a risk with this, and I just always like to say it. If you have any operation not under insurance and you have a complication, even if it's something insurance might normally cover, they may not, and we cannot guarantee you that that's your final cost. We almost always, if there's a problem that we have to go reoperate on, we don't charge anything more beyond that. But the hospital charges we cannot control, and medication charges or nursing home if somebody needs long-term stay. It's not very common, but it does happen. We're a very busy practice, and we have that from time to time, and we do accept patients who have had surgery elsewhere, and if they don't have coverage, that can be a real financial burden for them. So I don't want to minimize that.